Good afternoon and welcome to Globus USA. I'm Dr. Eric Burman. I'm a physical therapist and a product specialist here at Globus. Today we're going to be taking a deep dive into Diacare therapy, what it is, the therapeutic effects on your patients, and how we're trying to get them better using Diacare therapy, the difference between your capacitive and resistive ways of delivering the waves that the Diacare machine is creating, as well as the different frequencies that this machine is creating and how we're using those frequencies to target different tissues. It's important also to think about the intensity that the machine has, the amount of power that it's generating, and what stages of healing your patient is at, and what we're trying to deliver for that patient the best. And lastly, we're also going to be talking about the geography and how we are going to be placing not only the active electrode, but also the return plate that is going to be placed under your patient. This is also very important because we're trying to deliver all of the energy to the correct structures, okay? So to begin, what is Diacare therapy? Diacare therapy improves microcirculation, thereby promoting healing, maintaining balance, and improving performance of that muscle or structure. Diacare applies high-frequency electrical currents to generate endogenous heat within the body. Therefore, we're trying to get that patient to be able to move, feel better, promote healing and circulation throughout most of your tissues of your body. The therapeutic effects of Diacare therapy include increasing biostimulation, healing, and tissue regeneration, while at the same time we're trying to decrease things like inflammation, edemas, muscle tension, contractions, and also joint stiffness, thus making the body move better, help your patient through the other areas of your practice. It's important when thinking of Diacare therapy to compare the difference between a capacitive and resistant ways of delivering the waves throughout the body. We're going to be targeting different things. So if we start on the capacitive side, we're using an insulated active electrode, and the patient is going to find that the heat is going to be local to the head of that electrode. Therefore, we're targeting more of the superficial tissues, those very close to the surface of the skin, including the surface of the skin as well. This is going to improve things like blood circulation, increasing tissue elasticity, reducing pain, and as well as swelling in those targeted areas, again, superficial to the electrode. Resistive, on the other hand, the patient is going to be feeling things more deep to the surface of the skin. Okay, so we're using a conductive electrode, and we're going to be moving that around, and we're going to be sending energy to the return plate, usually placed underneath the patient or adjacent to the patient, and then we're sending that energy back, and they're going to feel the energy and the heat at the area of the most resistance in that tissue. This is going to be deeper structures such as deeper muscles, joints, bones, and just deeper injuries in general. We're going to be improving cellular metabolism, enhancing deep tissue repair, reducing chronic pain associated with those deeper structures. If we keep moving on, we're going to be back to frequencies. We talked about this a little bit already. However, it's very important when doing Diacare therapy to consider each frequency for your treatment. The Diacare 8000 Pro has 6 different frequencies that we can use. Each one is going to be slightly different. A lot of people talk about Diacare therapy and they say the lower the frequency, the deeper it goes. It's a good way to look at it, but it's not necessarily 100% true. What we want to think is the lower the frequency, we're targeting tissues with a higher impedance and thus have a lower water concentration. So we're going to be able to get to those deeper areas. Usually the structures with a higher impedance are the deeper tissues. So at 400 hertz, for instance, we're going deep. We're trying to get to the bones in the tissue. At 448, we're still going to hit to the bones, but we're also going to get the ligaments, the tendons, and the fascia. At 470, we're going to be impacting more of the muscles. 700 with the lymphatic system. And then the 1000, 1200 hertz, we're going to be very superficial, or at the surface of the skin, and targeting scar tissue as well. Moving on, intensity, the power of the machine. This machine is very powerful. Our Diacare 8000 can generate 350 watts of power, and that's delivered throughout the entire treatment. Now, as you know or are learning, you are changing the power throughout the treatment. You get to choose between 0 and 100% of the power that this machine can deliver. And each of those percentages are going to be targeting a different stage of healing or a different stage of the condition. As most of you would know, at a very acute stage, we have a lot of inflammation. There's a lot of heat already there. We don't want to be putting more heat and generating more heat in the body at those areas. But we still want to start the treatment and get it rolling. So with this machine, we're going to be looking at a 0 to 30%, which is an athermic form. So we're not generating more heat, but at that early stage, we can start to treat the tissue and start improving that circulation while still decreasing inflammation. From there on, from a 31 to 60%, we're looking at a more thermic way, and from 61 plus is hyperthermic. Moving on, so some of the most important things that I like to look at and we consider here at Globus is the geography and the placement of not only the active electrode that we have on the side of the machine, but also the return plate that is usually placed underneath the patient. So as I'm starting to set up this treatment that we're going to be doing, I want you to think about where I'm placing things and why we're doing that. So I'm going to have my patient lay down on the table here, and we're going to be treating the low back here, specifically the left lower portion of his lumbar spine. So important things that we have to do. We also have to use our cream here. We created a cream that has a conductive component and helps pass that energy from the active electrode to the return plate. So what we're going to do is we're going to spread some of this onto here, all right? And we place it underneath the patient. So for Fabio, we're going to be placing it in his left lower quadrant. Because that treatment area, as we talked about, is going to be this left lower side of his body, left lower side of his back, rather. So just a quick recap. We have our therapeutic effects. What is it increasing? Biostimulation, healing, tissue regeneration, while decreasing that inflammation that's building up, the edema, muscle tension, contractures, and joint stiffness. We need to know the difference between a capacitive and a resistive mode of transferring and using that electricity. The capacitive, we're going to be more superficial. Resistive, we're going to be a lot deeper into the tissues, okay? The frequencies, which ones are we going to use? Why are we using a lower frequency versus a higher frequency? Again, we can kind of cheat the system. We can think of it as a 400 is a deeper treatment versus a 1200 is a very superficial. And then the intensity. What intensity are we using? What stage is this patient in the healing process? And that's how we're going to dial it in. We want to make sure that that patient is comfortable. We don't want to be building up so much heat that they're uncomfortable, it's too hot, and that they're jumping off the table, of course. And then, of course, the geography, like we're just talking about here. So as we get started, we're going to zoom in here at the Diacare. So you can kind of see what's going on. With the Diacare 8000, we have a lot of different abilities, different ways to choose programs, and that's going to help you move on through the treatment process pretty quickly and get to the treatment of your patient. So we have a body atlas. This atlas contains all different areas of the body, as you can see. You can touch exactly where you're going, and then it's going to give you suggested protocols and programs that you can run with that patient. If we go back here, we can also go sport specific. There's loads of different sports in here. All of them have different kinds of injuries that are common in those, and it'll give you the exact protocol for that injury. But what we think is very important is to understand the Diacare and understand what it's doing and how to set it up. So we're going to use our free program technique today, but we're still going to use the quick start to show you how quickly we can get to treating the patient. Things to consider now. What size of the head are we going to choose? We're using the low back, so we can use a bigger head to the active electrode here. And we're going to start in a capacitive form because we're going to warm up that tissue, okay? So we're going to go for that superficial warmth. We're going to be moving it around local to the head of the electrode, and we're going to start moving through those the structures like the muscles in his low back. Well, then I'm going to show you, we're going to go into more of into the resistive as well, okay? So you're going to zoom you back out. So once the head of the active electrode is placed on the body, the important thing we're going to do is we're going to calibrate. What is calibration for a TechR machine or for the Diacare specifically? When we calibrate, we go ahead and we're starting, and it's measuring the impedance of your patient's body. So this is going from the return plate to the electric to the active, and we're making sure that there's not going to be any zips or charges throughout the body. So we're protecting the patient, making sure they're very comfortable. So right away we can start by increasing the intensity. One of the great things about the Diacare is that it's giving us direct feedback immediately. So we can see how much energy is being put into the body, or is being generated at the tissue. We can also make sure, as we're going up here, it's going to generate heat within that tissue. And we can see in a colorful graphic on the screen the exact heat buildup, and it's showing a relative to the color of the graphic how much heat is there, so the provider can be assured that they're not putting too much heat into the body. There are many different programs that we can use using the Diacare. There are over 360 pre-programmed protocols already built in. That seems like a lot. However, like I said, a lot of providers like to use their own protocols. They like to build their own treatment sessions. So we have the ability here to put users into the Diacare. So we can put 999 users into the Diacare, and from there, each user can create 999 of their own protocols, almost an infinite number of different protocols and uses of this machine throughout the body and whatever you're trying to target that tissue. You might be hearing a little bit of noise. What you're hearing is if the head of the electrode is getting removed from direct contact to the skin, or you pivot a little bit and it changes on the surface of the skin, you're going to have an audio feedback. So as you can see, if I take it off, you're going to hear that noise. That lets you know that you're not creating great contact, and you can kind of fix the way you're either holding the head of the electrode, or figure out if maybe you're not using the correct size head. So by now the patient would be feeling a local heat all over wherever you're moving that electrode. So as we move it across the back, as we move it down towards the pelvis and towards the glutes, he's going to feel it directly where the head of the electrode is. We have a pretty low here, but we want to keep it moving anyway. You always want to keep the head of the electrode moving, as you don't want to generate too much heat in that area where the patient be uncomfortable or it feels very, very hot. So what I like to do is I like to start with the capacitive. Either way, we kind of get those tissues warmed up, and then we can pause it, we can stop, and we can move to a resistive after that. So you can take it for a couple minutes, then we move on to the resistive side. Again, with the resistive, we're now going to dive deeper into that tissue. We're trying to get down low, maybe into the deeper muscles, towards the joints, and things like that. So what we're going to do is we started on 470 hertz in a capacitive function. We're going to first change this to resistive. We're going to drop down to 448 hertz. Now that we're going to resistive, we're trying to get deep down into that tissue. We're going to come back over here. We're going to add a little bit more of that conductive lubricant. We're going to place it on our patient. Go ahead, hit OK here. And once again, we're going to calibrate the machine. Get it too. Great. So there's a loading screen. It's going to tell you just to hold the head of the electrode exactly where you're going to be treating, so it can start reading that impedance and make sure that the patient is nice and safe and prevent any kinds of zips. So once again, same similar situation. We're going to start by turning up the intensity, moving the head of the electrode around. And this time, as we were saying before, we're going to be going after those deeper structures. We're going to be targeting the areas with the most impedance. So wherever the most impedance is, that energy is going to get bound up, and it's going to create more heat in that area. So with the Diacare 8000 Pro, there are lots of different ways to generate the energy and to use it throughout the body. So we have, of course, this is like our normal mode. We're using the return plate, but we can also use a mobile return plate. So it's in a very similar attachment to this, and you can actually be holding it on the patient and having them move and go through exercises. We also have the ability to use a hands-free kit. So therefore, we can almost use it as if there's sticky pads of electrodes, and it's going to generate the same kind of treatment. However, you can have the patient going through exercises or mobility on their own. You don't have to stand there and treat the patient. We also have one of our favorite things is going to be our fascia tools. So we can hook up pretty much an instrument-assisted soft tissue management tool directly to the Diacare machine, the Diacare 8000, and we can be going through that soft tissue manipulation at the same time as we're generating the Diacare and generating the heat within the body here. So same way, we can see how much heat we're generating. And we're getting all the live stats directly on the machine here. I'll give you a little bit better of a look at the screen as we're finishing up. And you can see the graphic here of what's going on. So we're not going to go through the entire treatment. As we've been talking the whole time, I don't want to keep flooding you with information. If you do have questions, please reach out to us here at Globus. We'd be more than happy to answer all of your questions. My name, again, is Dr. Eric Berman, and I want to thank you for joining us here today. And if you have any more questions about our Diacare or Take Our therapy, we'd be more than happy to answer them. Thank you.